Stress Physiology, the real cause of diabetes that we misunderstood. Hi, everyone. This is Real Easy Med Terms. In this session, we will learn about stress physiology, the real cause of diabetes that we misunderstood, Chapter 4. The real cause of diabetes. 4. The real cause of diabetes. During exercise or stress response, peripheral blood vessels constrict due to the action of the sympathetic nerve, and glycogen and fat are broken down by the action of stress hormones, resulting in an increase in blood glucose and fatty acid concentrations. If you are exercising, you do not develop hyperglycemia or hyperlipidemia because skeletal muscles use these increased glucose and fatty acids. This is because resting skeletal muscle can absorb blood sugar only with the help of insulin, but exercising skeletal muscle can absorb blood sugar and use it as energy without insulin. However, if you are stressed and do not exercise, the increased glucose and fatty acids are not consumed and remain in the blood, causing hyperglycemia and hyperlipidemia. When peace comes after the crisis, the parasympathetic nervous system works, and the relaxed human body rests. In addition, blood is supplied to organs that have been pushed out of priority, allowing the digestive, urinary, and reproductive organs to resume activity. This is called the rest, digest, breed response. During the rest, digest, breed reaction, insulin is secreted, allowing cells to absorb glucose and use it for energy, and store the excess glucose as glycogen and fat. Therefore, it can be seen that the reason that the cells develop insulin resistance in type 2 diabetes, where the cells do not obey the commands of insulin, is because a large amount of the stress hormone, which has the opposite effect of insulin, is secreted. Taken together, high blood glucose and fatty acid levels indicate that the muscle has an energy source that can be easily broken down at any time due to a stress response in a crisis situation. In other words, insulin resistance is a means to raise blood glucose level and fatty acid level in stressful situations, but insulin resistance itself cannot be said to be the cause of diabetes. This means that, when the parasympathetic nervous system suppresses the sympathetic nervous system, and the secretion of stress hormone decreases, insulin resistance disappears, and insulin sensitivity comes back. According to the data that studied the effect of stress hormone on blood sugar level, it can be seen that the blood sugar level rises by more than 50% when epinephrine and cortisol are secreted together, than when glucagon is secreted alone. In this figure, the lower lines show the blood glucose level when either glucagon, epinephrine or cortisol is secreted alone. Epinephrine raises blood sugar level the most, but only around 120 mg per deciliter. However, when glucagon and epinephrine are secreted together, the blood sugar level rises to 150 mg per deciliter, and when glucagon, epinephrine and cortisol are secreted together, the blood sugar level can rise to more than 250 mg per deciliter. Even if diabetic patients manage their blood sugar well, through diet and exercise, their blood sugar levels may soar for no reason. The real reason their blood sugar levels rise is that they are currently under extreme stress. In the early stages of type 2 diabetes, the pancreas secretes insulin 3 times more than normal to lower the elevated blood sugar level. However, even if the insulin level rises more than threefold, it cannot keep up with the degree to which the stress hormones and glucagon combine to raise blood sugar level. People under stress are ready to raise blood sugar level at any time. In such a state, diet and exercise therapy have the effect of eliminating raw materials that can raise blood sugar level. Even if blood sugar level is managed through diet and exercise therapy, as long as the stress hormone is excessively secreted, as long as the raw material is supplied, blood sugar level can rise freely. If you do not know this fact, you may make the mistake of neglecting diabetes management, by mistakenly thinking that diabetes is getting better, when blood sugar level starts to be controlled, through diet and exercise therapy. Diabetes mellitus is a disease that causes hyperglycemia and hyperlipidemia, in stressful situations, by producing a lot of glucose and fatty acids, to supply energy for the fight-flight-freeze reaction, controlled by the sympathetic nervous system. Therefore, in order to be liberated from diabetes, it is necessary to suppress the sympathetic nervous system, and activate the parasympathetic nervous system, so that the rest, digest, breed reaction can proceed. To do this, it must be possible to eliminate the cause of the intense stress response, or, if it is a stress that cannot be eliminated, no longer be subjected to mental and physical pressures, from its presence. When you are freed from stress, peace of mind and body comes, and the glucose and fatty acids made in abundance are stored in muscle cells and fat cells again with the help of insulin, so hyperglycemia and hyperlipidemia do not occur. In this class, we studied that hyperglycemia occurs when a large amount of stress hormones such as epinephrine and cortisol are secreted in a stressful situation. Therefore, it was found that diabetes is not a disease in itself, but a normal response of the human body to stress. We also studied that if the parasympathetic nervous system is activated and the sympathetic nerve can be suppressed, diabetes can be expected to improve. In the next lesson, we will learn about the real symptoms of diabetes that we misunderstood. This is Real Easy Med Terms. Have a great day. See you again.